Which of the following is not a feature of difficult neck in head and neck surgery? Options are short stocky neck, retropharyngeal nodes, previous history of cervical trauma, and involvement of the vital structure. Correct answer is C. Previous history of cervical trauma. While trauma may complicate surgery, it is not classically listed as defining feature of difficult neck. The standard criteria include short neck, retropharyngeal nodes, recurrent disease, and vital structure involvement. The term difficult neck refer to clinical and surgical scenario where access, visualization, or intervention of the neck region is challenging due to anatomical or pathological factor. This is particularly relevant in head and neck surgery, thyroid surgery, neck dissection, or parathyroid surgery. Feature of difficult neck. First is difficult to assess due to altered anatomy, prior surgery, or radiation. Second is short stocky neck, limits surgical exposure or anatomical orientation. Third one is retropharyngeal lymph node involvement, hard to assess lymph node situated deep in the neck. Fourth is recurrent disease. Previous surgeries or recurrence disease may lead to abnormal anatomy or abnormal plane. Fifth is involvement of vital structure. Tumor of inflammation which encasing the carotid, jugular vein, vagus nerve. These are the criteria for difficult neck.